podcast. Hi, everybody. This is Bill here with OET Prep Podcast. And today I have with me a very interesting person here, and we're going to be talking a lot about, different topics. I'm very excited to learn more about the IMG pathways for international medical graduates to get certified in the Canadian system. We might also touch a little bit on the healthcare system in Canada. So relax and enjoy our podcast today. So I'm going to give you the microphone to introduce yourself. So please go ahead.
Hi, everyone. So, first of all, thank you for inviting me for this interview. I appreciate the opportunity to give me a chance to, say hello and to express my opinions. So, I'm Dr. Sarah. I'm an admin for Melman Medical for Dr. Mike, who created Melman Medical, but I also am a creator of Clinical Focus from St. James School of Medicine, as well as what is known as Study Group Prep USMLE, which is a YouTube channel, Telegram group where we just study together and go over USMLE concepts. And that's actually how I discovered Mr. William Ado. It was through OET prep information because I was getting questions from my students saying, how do I prepare for this OET exam? And I was like, you know what? I need to find a professional who has the expertise and the knowledge in order to properly answer these questions. And that's how we came about this introduction. So
Yeah.
thanks again for inviting me. But yeah, that's basically who I am. I'm just a med student surviving the USMLE journey and making my way through the path like everyone else.
Great, that's awesome. So you also mentioned that you run a Telegram channel for
Mhm.
OET preppers. So what motivated you to create this channel?
So I created this channel for Study Group Prep USMLE because I felt there was a space that was needed in order to freely discuss all types of resources. So in Study Group Prep USMLE, if I have someone asking about the OET exam or the exam in, let's say, the UK, or is asking about legislation in different countries, I noticed that a lot of international students required a platform where they could, one, study and freely discuss resources, as well as ask a multitude of questions on various processes depending which country they were from. So this study group allows us to study for the USMLE, for the MCCQE, but we also have students that are studying for other types of exams from other countries as well. So it's a
Right.
really nice international group that allows us to study together, motivate each other, and it's like a safe space where you can expect professionalism.
Mhm.
I think it's a great environment so far. People are happy with it. So
Right, that's awesome. And how long have you been running this channel, and have you seen some growth in the channel since you started?
So that would have been about 4 or 5 months ago.
Oh,
Yeah,
wow.
it's relatively new. Like I literally just gave birth to this baby. And it grew legs and started to like walk and it's turned into this whole monster on its own, but it's like a beautiful thing, you know? So I'm pretty happy with it. It's fairly new, this entire thing. Clinical Focus from St. James School of Medicine has been around for a while. That has been a project that's been going on for about, 3, 4 years since I created it. But the whole Telegram thing and YouTube channel, the YouTube channel is just 4 days old, but the
Right.
Telegram study group is 5 months old. So all of this is very new, and I just created because I saw there was a need to connect students and help people from various backgrounds and various walks of life that are attempting to be an MD, regardless of which country they were from or
Right.
which country they were trying to go to, you
Mhm.
know? So yeah, it's fairly new, all of this.
Right, that's awesome. And also, I noticed that the channel is growing really fast because you just mentioned that it's been
Yeah.
open for only 5 months, but I think you've hit like the 1,000 subscriber mark. So you're doing incredibly well.
Thank you. Thank you.
Right. So
It's
how did it
growing.
all start? Why did you decide to become an MD?
Oh my goodness, that's the million-dollar question. This is the question they ask you when you're trying to interview for residency.
It's fine. Yeah.
Where do I begin? It's multifarious. There are
Right.
so many reasons, but I guess it really comes down to um, I love the feeling I get when I help someone. I feel that when you have that impact on
Mhm.
an individual and you see the change that you've implemented in their life and how it can personally affect them and allow them to grow and succeed and, overcome either an illness, and then you watch them grow and become even more than what they were before. Helping someone walk again is a beautiful experience. Helping someone overcome mental illness is incredibly rewarding as a clinician, and helping students, become professionals and how to ethically act in delicate situation. It's just there's the love of science. I
Mhm.
love being intellectually stimulating. I love asking questions and understanding the how and the why. It's also the want for change. To want to make things better, to fix things, to do a lot of good. There's so many reasons why I decided to become a doctor. And I remember, funny thing is, when I was 19. I was in high school, and I remember I wasn't very popular. I was very shy, very quiet, and I didn't quite fit in. I was very artsy fartsy, and I was taking English and I was taking history. And then one day I was like, okay, it's time to go to college. It's time to go to university. And my teachers, they were asking me, like, Sarah, what do you want to be? What do you want to do? And I was like, oh my God, like, I'm 18 years old. I don't know anything about life. I'm just a kid. And I was like, well, I can't be a doctor. I can't be a lawyer. I'm not smart enough for that. And then the teacher looked at me and she's like, why? Why do you think you're not smart enough for that? And I said, well, I do art and English. She's like, have you ever taken biology? Have you ever taken chemistry, math? I said, no, but I guess I could try. So I started taking those classes, and I just, like, I flew. And my teacher was like, oh my God.
Wow.
They're like, you need to venture onto different pathways. And I guess I just decided, you know what? To hell with it. Even though I'm an art student and I know nothing about science, I'm going to take a biology course. And I fell in love. I was fascinated by the science of life,
Right.
and those are pretty much the reasons, to be honest.
Right, that's awesome. I mean, if I remember from our earlier discussion, you are an IMG yourself, right?
Yeah.
So
hmm
why did you decide to go to medical school abroad? Why not Canada?
So in Canada, the medical academic institutions are very congested. There are, for example, so many people applying, and there's this many seats.
Right,
So there's not a whole lot of medical schools. There's about, if I'm not mistaken, 12 medical schools in Canada. Whereas in the United States, I don't remember exactly, but I think there's about 100 something
mhm,
schools. So
yeah,
you have more seats available in the States. And because the Caribbean medical schools follow the USMLE American pathway, I was like, well, if I get accredited in the States, I can come back to Canada and do the MCCQE. I can never say that right. And then be able to come back home and practice in my own country. But worst case scenario, I was okay going to the States. So I went to the Caribbean because one, there was a higher acceptance rate because they simply have the seats available,
right.
which means that with my average of, let's say, 93%, I couldn't understand why I could not get into medical school in Canada. I had a 93% average. I loved school. I loved academia. And I had the research, I had the volunteer hours, I had excellent letters of reference. And then I remember just, doing some research to figure out, like, why am I not getting in? And then people were telling me, well, people can get in second round, third round. So I could have eventually waited another 2, 3 years, but I was like, you know what? Let me just go to the Caribbean. I'll get accepted right away. I'll start medical school immediately. And financially, it seemed like it was feasible. So that's pretty much why I went to the Caribbean. I knew that I'd have a couple of hoops to jump through, and there was a whole reputation where, like, oh, you went to a Caribbean medical school. But I think that's starting to phase out now. I think people are getting accustomed to the fact that you have Caribbean medical school graduates that do an amazing job, that have become wonderful physicians, that have really broken the stigma of going to a Caribbean medical school because they see your skills and
Right.
what you can do, and then they don't care which school you went to, you know?
Right.
So that's pretty much like what I had in mind when I decided to go to the Caribbean.
Yeah, I'm really happy you addressed that question because I was just about to ask that. Do people look down upon Caribbean universities? But you just mentioned that that sort of stigma it's fading away. So that's a really good thing to hear.
Yeah, it's still there, but I feel like it's fading away because we hear about some successful graduates that are able to, get into Harvard research positions. And this is
Wow.
Harvard we're talking about. And then we have other medical graduates from, let's say, the Big Five who are able to work with professors at Yale, at Stanford. And these are considered like the Ivy League medical schools. So I'm thinking the stigma is slowly disintegrating, whereas 10 years ago, it was a big deal. You went on Reddit and you asked about IMGs going to the Caribbean, you were going to get roasted and grilled like barbecue, but now it's like, now it's like no one cares. It's like, are you competent? Do you have high scores? Are you a good doctor? Can you really, perform your skills and your duties as a physician? That's
Yeah.
what it's coming down to now, you know?
Right. Yeah, I'm very happy to hear that things are getting better now. So, well, you did mention the Caribbeans, which is actually huge. I guess there are a number of countries within the sort of Caribbean Union. So, do you mind sharing which exact university you went to and which Caribbean country you're talking about?
Sure. Yeah. I went to St. James School of Medicine
Mhm.
in 2019,
Right.
and I was in St. Vincent and the Grenadines initially for my first 3 semesters.
Mhm.
And then I was really curious about Anguilla.
Mhm.
So I went to the island of Anguilla, which is just the other campus of St. James School of Medicine. And I did my fourth semester and my fifth semester there before returning to Canada.
Mhm. Right. So, was there like a huge IMG community in your university?
What do you mean, like at
Like
Concordia for my
international
undergrad?
students, like a huge international student community in your university.
We were a small school, actually. I think we were probably 200 or 300 students in total. It was a small medical school. It wasn't like 1,000 students. It was an itty bitty little school. Like when you talk about the big five, like
Right.
Saba and St. George and Ross, like
Mhm.
I don't think they have thousands of students. It's a huge
Mhm.
campus and a huge student body, but usually these other schools that are not the big five, they're generally a lot smaller. So you get
Right.
more one-on-one with the prof. The tuition can be less expensive. There's pros and cons to depending which Caribbean medical school you write.
Mhm.
You
Mhm.
know,
Mhm.
I didn't need to write the MCAT. I was studying for the MCAT. But then when I discovered St. James, they're like, well, we'll take you right now. You don't need to write the MCAT. Whereas my friend, she went to Trinity Medical School on the same island in St. Vincent, and she actually had to write the MCAT exam, you know?
Right.
I didn't need to write the MCAT. So there's like differing pros and cons of which school you go to and what they require.
Right. So, how many foreign students did you have during your time of study or in your group? So
How
I
many
I went
students
to
did you
medical
have?
school in Russia, and
Yeah.
during my year group, there were just like two foreign students, myself and one guy from India. And the reason being that I studied in a very small city. If I had gone to Moscow or St. Petersburg, yeah, these cities have like huge international student communities. But like when you
Yeah.
go to small cities, you have just one option to study Russian language, and most foreign students, of course, are not very confident about studying medicine in a foreign language, especially in Russian
Yeah.
language. So they tend to go to Moscow or bigger cities where you are allowed to sort of study medicine in English. So
Oh, okay.
yeah,
Well, in my school, it was very small. We had a class of 48 students,
right.
and unfortunately, by the time, we were done each semester, there was a lot of students that were cut,
Mhm.
or who couldn't progress or chose not to. And so we finished with a class of maybe 5 or 7 students in St. Vincent for those who were of my class originally. But by then, I was in Anguilla, and Anguilla finished with a class of I think they were initially 60 something. And by the time it was the end, they were about 42, 43
Yeah,
students in one class for
right.
that year. But in St. Vincent, they were just 6 or 7. Like there was a lot of students who chose not to progress forward or
Mhm.
who were cut from the program. So every campus is a little different.
Very normal for medical school. So yeah, people get cut off, people. leave the profession or something like that. So,
Yeah.
what about duration for medical school in the Caribbean? So, in Russia, it's 6 years. It's standard for Europe. Like in Europe, people go to university medical school for 6 years, right? So, what's the duration in the Caribbean?
4 years. It mimics the USMLE American or Canadian time frame. So the
Okay,
first 2 years are basic sciences,
right.
like in the US and like in Canada.
Yeah.
Your third and fourth year are simply clinical rotations. You're in the hospital, you've written step one or the MCCQE, and you're no longer sitting in class anymore. And it's a total of 4 years.
Okay, right. So in Europe, it tends to be like 3 years of basic science. And then when you get to fourth year, it's considered a clinical year. So you spend a lot of time in the hospital doing rotations and, basically clinical stuff, like you mentioned. All right. So let's talk a little bit about the Canadian education system. So if I remember correctly, you have to do pre-med, right, before going to medical school.
Yeah, that was a whole other ball game.
Mhm.
I came from an artistic background, and so I was studying in the fine arts at Concordia University. I'm actually wearing their sweater.
Okay.
I happened to put it on today, but I didn't have the prerequisites, as they would call it, in
Mhm.
order to enter a science program or a
Right.
medical program. So I had to take an immense amount of biology,
Mhm.
physics, chemistry, organic chemistry. I had to take anatomy, calculus. There were probably a good year and a half of prerequisites that were necessary and added supplementally to my undergrad. So I
Mhm.
ended up switching from the fine arts to a psychology degree,
Mhm.
but I had to do an extra year in order to do all those prerequisites so that I could get into a medical school. Because let's say everything would have gone well and I would have gone immediately into a Canadian institution and I would have never gone to the Caribbean. Regardless of which path I chose, I had to get those prerequisites finished.
Yeah. And what about the tuition? I know in America, like they pay insane amount of money to go to medical school. Is it the same in Canada?
So that was also a factor in terms of why I went to the Caribbean because, um, financially, it is a huge commitment to
Mhm.
take on this path, and you are constantly trying to figure out when to work, if you can or if you can't, or how you're going to financially make this realistic. So a lot of us have to take out student loans from the bank.
Mhm.
So I found that the Caribbean medical school that I chose
Mhm.
was financially feasible because it was a lot less expensive compared to a Canadian medical school. And that was another reason why I chose St. James because I felt there was a difference of, was it 50, $60,000 in
Mhm.
terms of which school to go to. So, I had to, at the end of the day, also choose a school that I could afford because of the responsibilities that I have personally. And since the fact that I do work sometimes, I do have an employment. And so I have to balance academics and employment at the same time.
Right. Okay. So I'm a little curious about um, the healthcare education system in the Caribbeans. So the first 2 years you did mention that you do like the basic science subjects like
Mhm.
anatomy, physiology, pharmacology, and things like that.
Yeah.
How are the exams conducted? How's like the education system structured? Like how many years do you have to do anatomy? How the exams conducted? Are they like multiple choice exams or interview? Like I went to university in Russia again. I'll emphasize on that. And in Russia, like the exams are more like interviews. So anatomy exam, you go to the cadaver and then your professor asks you to point some nerves or muscles and stuff like that. And he can ask you some pathology questions and you should be able to give answers. And we also had this very interesting subject. I think it's called topography české anatomie. I just said it in Russian language. I don't even know how to translate it into English, but I think in English it will be more like topographic anatomy. That's going to be a literal translation. And it's
Okay.
very similar to like the regular anatomy, but this time you're sort of performing some surgery on the cadaver, right? So your professor can ask you to suture some nerves or like suture the skin and stuff like that. So it's like really, really, really practical.
Wow.
I did talk to my friends in other European countries who studied like in other European countries and they have no idea what it is. like topographia και anatomy. I can't even translate that into English. So, did you
Yeah.
have something similar? I'm just very curious about the education system, the structure, the hours you spend in class, like how the exams are conducted. Can you tell me about it?
Yeah, I can definitely do that. So I remember the first day of med school, I sat at the very front of the class because I was nervous and I had no idea what I was doing. And I was really happy and excited to be there. And I remember the teacher walked in, introduced themselves, presented the staff, and then the dean of academics simply told us, you are expected to be present at 8 a.m. at the beginning of class. Attendance will be taken and classes finish between 2 and 4 p.m., depending on what is scheduled that day. So,
Mhm.
for example, we would have semesters. We had MD 1, 2, 3, 4, 5. We had 5 semesters. And for example, in the first semester, we had anatomy. A semester was approximately 3 months, if I'm not mistaken. It's been a while since I was in med school. I'm not in class anymore.
Right.
But you would have, let's say, a full semester to do anatomy. And so anatomy would be taught in the morning by the anatomy professor. And then, for anatomy, we would have the lecture component, but there was also the cadaver component. So we would all go downstairs into the lab, put on our scrubs, and wear the appropriate attire. There was a dress code, there was a procedure in terms of how to enter the lab, how to exit the lab, and, how to conduct yourself professionally. And so you would spend, I'd say, probably 2 or 3 classes out of the week in the lab learning how to dissect, how to identify muscle tissue. Like you said, a nerve, the professor could ask you a pathology in relation to a nerve, could expect you to identify the supraspinatus and ask you about the rotator cuff muscles and whether it's the infraspinatus and there's an external rotation.
Right.
So there was that too. And, we had multiple choice exams where at the very end of the semester, we had a final exam. It was multiple choice, but there was also a interview like exam, like you said, where we would walk into the lab and the professor would ask us to identify it and would kind of like poke our brain to see like what we knew about the pathology, So there was that component for anatomy. For the histology class, it was the same thing. There was the lecture component, and then you had to go to the microscope and, if the slide was presented, you had to be able to identify the clock face chromatin of, let's say, a plasma cell. You
Mhm.
had to be able to identify what a lymphocyte was versus a macrophage, So that was interesting. You had the written component that was multiple choice. It was computerized. It was monitored. There were cameras in the room. There were proctors. It was assessed by CAM, HP, and various boards that are accredited to make sure that the environment respects the American curriculum to avoid cheating, plagiarism, things like that. So that's pretty much how it was conducted, to be honest, throughout the semesters for each course. And with pathology, it was mostly lecture based and multiple choice because there was no lab. At the very end, though, for the
Right.
fifth semester, we had a clinical component where they would have actors or mannequins that would present in a clinical vignette. So, for example, if we were doing obstetrics, there was a mannequin for the obstetrics, and you would have to answer questions. If, let's say, there was a childbirth being simulated, they
Right.
wanted you to identify not just the anatomy, but also the type of complications that could come from, let's say, a breech presentation, things like that.
Yes.
So
Yes.
that's pretty much how it went, to be honest. Does that
Yeah,
answer your question?
we had a similar curriculum as well. And
Yeah.
yeah, it sounds like Caribbean universities seem to be very strict, in my opinion, especially when you mentioned that you have to wear a specific attire for anatomy or what have you. And we had pretty much the same system in Russia. Even for lectures, you have to dress a certain way and you have to have your white coat on. And sometimes some of the professors would also force you to wear some hats, which I really hated wearing. Yes,
You had to
exactly.
wear hats?
Yeah, some really,
What?
really like white hats. Yeah, especially
Oh
for
my
the
goodness.
anatomy lab. Yeah. So,
I was in my scrubs. Like you had to wear scrubs for the lab, but I was so comfy in my hoodie and my scrubs. I would just wear a hoodie and scrubs to class if I was tired because they become like pajamas. They're amazing. And I
yeah.
loved my running shoes. But yeah, it was the professional attire that was expected. You like if you had a presentation,
Yeah.
would put on like a suit and tie. You had dress pants, dress shoes, especially if you were presenting a research project that was going to be published. You were
Right.
expected to dress as though you were going for an interview. But if it was just a regular day in class and there was no lab, you
Yeah.
could wear a hoodie and scrub pants. And as long as you didn't show up in pajamas, you were fine.
Yeah. Right. So that seems more relaxed because in Russia things were quite strict, right? So you done with medical school in the Caribbean, you come back to Canada, right? I don't think you just sort of in the system, you probably need to have you need to go through some procedure to get certified as a doctor in Canada, right? So do you mind telling me about the procedure? How does it work, right? As a Caribbean
So
trained doctor.
basically, whenever you're done writing step one,
Mhm.
you do clinical rotations
Mhm.
at affiliated hospitals in the US, generally for Caribbean medical schools. However, my school, I'm lucky. I can do clinical rotations in Montreal, in Toronto, in Vancouver. I just need to acquire the appropriate paperwork and
Mhm.
have it approved by the hospital. And then the school agrees to it, and I'm able, let's say, to do it in my own country. But there are some core rotations that have to be done in Chicago, in New York, and I believe we have a hospital in Texas where we can go and rotate as well. So for a year and a half, we do clinical rotations. And then once we're done with that, in order to write the MCCQE, you generally have to apply to the Canadian website. There's a physician application website where they show you
Right.
step by step how to apply to the MCCQE. And that's basically it. Like, as long as your school is accredited and you follow the procedure, generally the exam department and the clinical rotations department will guide you in terms of, okay, fill out this document, send off this paper, sign here, and as long as you just progress forward, generally, if the school is accredited and under the certification process, because there's many different boards
Right.
depending which exam you're writing, generally they guide you through the process, but there are websites that you can go to in order to just make sure you check off the box, but
Right.
you're able to write the MCC QE and write the step one exam. And what's great is that the MCC QE, as of May 2021, the part two, it doesn't exist anymore. So you just have one exam,
Oh,
you know?
wow.
Yeah,
Wow.
I recently discovered that. I was getting ready for part two.
Mhm.
And then when I looked it up on YouTube, just to make sure I had my ducks in a row, because I had a feeling you would ask me. And I
Mhm.
was like, do they still have that exam? Like, I heard that it was nullified. And so I went to go check it up. I'm like, oh, they don't have MCCQE part two anymore
Mhm.
as of
Right.
2021. And that
Yeah.
was a big deal, because you had two exams. Now you just have one,
Yeah.
So for the Canadians, that's what we have to deal with. Whereas with step one, USMLE, there's step one, step two CK, and for some there's even step three, so it's
Canada,
different.
because for some reason I feel like Canada is very underrated. I do prepare a lot of people for the OET exam. I've worked with people who are trying to get certified for the UK GMC, General Medical Council, for the US, for Australia, but for some reason I never really have people who are aiming for Canada. But why so? What's the reason?
Like I said earlier, the congestion, the system is very congested. Unfortunately, we have this many people applying, this many seats. And it was one of the reasons why I went to the Caribbean Medical School, because I didn't want to wait another year and then another year and then another year to get in. I was fed up. I was like, I want to start studying now. I want to start my medical career immediately and I want something affordable. So
Right.
I had two factors. So a lot of people don't want to necessarily come back to Canada to practice because, first of all, in Quebec, we're the least paid physicians. We have
Mhm.
different provinces, and Quebec is the least paid physician. So we have people that decide to leave Canada and work in the US because they're paid a lot more, right? And in Canada, the system is different in the sense that it's a public healthcare system. So
Mhm.
yes, there's a huge waiting list, but you have things like OHIP, which is the public funding used for Ontario, where you just present a health card at a hospital, you walk in and you get treated. And from my understanding, since I'm not an American citizen, that's not the case in the US. There's something where you have to deal with the nightmare of insurance policies and
Right.
making a claim for paying a fee, and that some people will end
Right.
up going into financial ruin in the States because unfortunately they can't afford the medical fees. But in Canada, we don't have that.
Right.
We have these cards per province that we present. However, when we need something extra, we need something specialized, or we get put on a wait list, it can take up to a year, if not two, before we see someone if it's not urgent, if it's not something that is immediate. And even then, sometimes when it's urgent or important, whereas you could get an MRI that should have been done 2 months ago, you might end up waiting 6 months before you
Yeah.
get it, you know?
Right. Yeah. So it seems to me that there's no system to sort of integrate foreign medical graduates. So, for instance, if I want to work in the UK as a Russian trained doctor, I just have to take two exams. That's the PLAB 1 and PLAB 2, and then I can get into the system. I can get certified by the General Medical Council. But I mean, I've been trying to sort of do a little bit of research into Canada on how foreign medical graduates could, get licensed to work, but it seems that there is no system like that. It doesn't even exist, right? You need to either have a permanent resident permit for Canada, or you need
Mm,
to be you need to be a citizen.
I'm not sure to be honest, because
Mhm.
when I was doing research about the MCCQE Part 2,
Right.
that is now no longer in effect as of 2021, the individual that I was consulting was telling me that him and a lot of his classmates wrote step one and then they wrote the MCCQE afterwards, or vice versa. You
Yeah.
know, I thought that was interesting because he was telling me I used the exact same QBank. I used UWorld to write the Canadian license exam and the American license exam. And I'm like, huh, that's interesting. So I feel like there's an overlap. I
Mhm.
feel like if you're in Canada or the US, it doesn't really matter. You could do both. It's just when you get to the Canadian system, expect not as many seats available, and you're more likely to match for residency in the US simply because there's more hospitals and more schools and just more seats available,
Mhm. Mhm.
from what I gather.
Right. So overall, how would you rate the Canadian healthcare system? I do believe that there's no perfect healthcare system. You did mention that in Canada, you have the universal healthcare system. It has its own problem, pretty similar with almost all European countries, right? There's like universal healthcare system. Nevertheless, it takes a long time to book an appointment with a specialist, right? Whereas in America, you pay, but it's way easier to see a specialist. Nevertheless, I do prefer to live in a society which offers free healthcare to citizens. Well, it's not free because we pay taxes for that. But what do you think about the Canadian healthcare system? Do you think there's still more work to be done to improve the system? What do you like about the system? What don't you like about the system?
So overall, I think it's a good system when it comes to having a health card. I like the fact that I have an OHIP card from Ontario, or a RAMQ that they would call from Quebec,
Mm,
where you just go to the hospital and you present that card. But the thing is, the downside is that even though you're not paying for it directly, because yes, it comes out of your taxes, if you don't have a family doctor, you could wait at the ER for a good 8 hours or 10 hours for a simple
that's
prescription of
insane.
penicillin, and you just have an ear infection that is refractory and doesn't want to go away. You've already been seen twice and you're at the point where, like, okay, we need to do antibiotics. You
Mhm,
might wait 8 hours at a hospital versus if you go to a private clinic, and we have those as well. We do
mhm,
have private clinics where you can pay and you can, provide uh, a fee where the person is able to be seen within the next week if, let's say, they don't want to wait and go through the public system. And that's becoming even more popular now. And
mhm,
I've had to do that a couple of times. There was a couple of my family members where they had very complicated conditions that required a very specialized approach for something that was complex. And we were left with the choice whether we would wait 6 or 7 months, for a specialist. And then I did some research and I Googled and I found a private clinic. I looked up the fees and then I decided with family members, okay, can we afford this? Yes. Okay, great. And then I was able to book an appointment. And the very next week, that family member was able to see that specialist.
mhm.
So there's like two sides of the coin where we have access to both, and the paid aspect is becoming more popular now because of
Right.
the quicker time frame. You know, the time frame
Absolutely.
and the waiting is what's an
Yeah.
issue.
Right. I'll be very happy to pay to see a specialist just to prescribe antibiotics for my otitis rather than wait several days to or wait 8 hours in the ER. Yeah, that's insane. Yeah, let's talk a little bit about the preparation for the STEPS exam, right? I know it's a very difficult exam. It's physically draining, emotionally draining, mentally. It's really tough because I do work with a
Yes,
lot of
yes, 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 yes.
absolutely. How do you overcome the stress of preparing for the STEPS exam, the STEP exams?
So that's actually a new video that I just made on my YouTube channel because I feel that this is something that is not addressed readily. A lot of people are uncomfortable talking about mental health because of stigma, cultural values, or religious aspects, and it's something very personal. It's normal to feel uncomfortable, even as a physician,
Right.
whenever you're dealing with a patient. But how I overcame that. In the video, I talked about how I did various things such as sleep hygiene. It was recommended to me by my mentor, by Dr. Mike, from Melman Medical. He said, get a full night of sleep. And I was like, you know what? Let me try that. So I went to bed at the same hour, woke up at the same hour. That helped lower my anxiety. And then at some point, if I got sick or I wasn't feeling well, instead of neglecting my health, I sought treatment, and I noticed by taking care of my health, whether it was physically or mentally, it helped me reestablish focus so that I could get my work done and do my 40 to 80 questions a day. But, it wasn't perfect. Like there were days where I felt, either confused or lost, or I wasn't sure if I knew what I was doing. And then there were other days that were great, where I was confident, it was going well, I was very productive. And so you have to be patient with yourself because it is a roller coaster. There are good days and bad days. And no one's prep is perfect. I have my own method. I had a mentor. I discovered some amazing content. And then I shared my experience with other students and create a space where we could talk about these things, like what should I eat? How do I cook? Like how do I budget while I'm a student if I'm working? Can I work while I'm studying? If so, how many hours? Things like that. So that video was all about the personal aspect of how to multitask life as
Mhm.
you're doing the USMLE because we all have a life. Some of us have kids, some of us are married, some of us have family members that we're responsible for. And so there's all these extra factors where we need to address them because they're important. You can't
Right.
expect everyone to be available to study 8 to 10 hours a day.
Right.
Eventually, yes, hopefully at some point. But sometimes you have, other things at play as well. So,
Right. Right.
yeah.
Absolutely. And would you recommend all step takers to have a mentor?
What's it like having a mentor? Is it
Yeah,
like a
yeah. Would
good?
you recommend all step takers to have a mentor, like somebody to mentor them? Does that help? How did Dr. Mike help you get through your step or
I
your preparation?
feel like he would snap me back into the right direction. If I was whining or complaining or I was just overthinking,
Right.
he would just be like, snap out of it. Stop overthinking. It's not complicated. I would watch a video on his exam guidance playlist and I was like, wow, this is so good. I'm like, this guy's so right. And then I would go and do it and I was like, oh my goodness, I feel so much better because I feel like it's going better
Right.
academically. I slowly saw the results and I had a couple of friends that, were already in residency as well in Chicago. One of my really good friends actually passed the exam before me and had progressed quicker than I did and is currently practicing in Chicago. So I would ask him, hey, what do you think of this? Or how do I deal with that? So I think it's great to have a mentor. I think you have to be careful about good advice and bad advice because there are some people out there that are either looking to make money or that will try to sell a Q bank online, and you have to be careful of scams and things like that. And sometimes people don't have good intention. They just want to make money off of you as a tutor.
Mhm.
So I think it's great to have a mentor, but you have to select the right one for
Right.
me, Dr. Mike was the perfect mentor because he's all about tough love, and I respond well to tough love under pressure. That's just how I function, you know? You know. So everyone has their own style, but yeah, I think having a mentor, it can be a really good thing, and I feel like it made me stronger, to be honest.
Right. That's awesome. So I'm going to ask you one more question, and this question is going to be quite controversial.
Uh-oh.
Where would you prefer doing your residency? Would you prefer doing it in Canada or in the US?
Oh man.
I told you it was going to be controversial.
Yeah, yeah, because I'm wondering like who's gonna watch this after.
Very provoking question.
Yeah, you know what? Honestly, I am open to both opportunities. I would love to practice in Canada and I would love to practice in the US. I think it's going to come down to who accepts me first, you know,
Right.
and who wants me the most. Because I think, you know, it's an amazing opportunity to practice anywhere in North America or in Europe. And if let's say things don't work out in Canada or the US, I would be open to Australia. I would be open to the UK. You know, I am not limiting myself to just one country because I understand that there are physicians from other countries that are incredibly knowledgeable,
Yeah.
that are so skilled. Like I remember in class, I had people from Russia, I had people from Ghana, I had people from Japan, I had one person that was from Nigeria, and
Right.
I had someone from Texas. I had people from Germany. I was so amazed to
Yeah.
see these physicians from all these different countries, but I think I would just love to practice in both, and that's my diplomatic answer because I'm very much someone who is strong on diplomacy, and I usually put out the fires and I diffuse a situation, and I will calm everyone down when things get controversial or delicate or heated in a discussion.
Right.
I'm the one that gets everyone to play nice, so that's my diplomatic answer for you.
Right, that's awesome. I just realized that actually I haven't really met any international medical graduates working in New Zealand because you did mention the US, you're open to the US, you're open to the UK, Australia, but for some reason you missed New Zealand because these are all English speaking countries. So I think
Oh,
I definitely need to get like an IMG practicing in New Zealand aboard. So yeah, help me find one.
hey, if I find one in my group, I will definitely refer to them. I'm already referring everyone in my study group to your channel for OET
Yes.
prep
Thank
because
you. I do appreciate that.
I
Yeah.
I also have people in WhatsApp, you know,
Yeah.
people from India, from Pakistan, you know, from Bangladesh, from like uh, Saudi, from you know various countries, Lebanon. They're all asking about the OET, and I'm like, oh
Right.
my goodness! And that's how I found you. I was
Yeah.
like, Bill, please help me with this.
Right.
I'm
Absolutely.
gonna send them all to you.
Right. I also realized that lately, the United Arab Emirates is becoming a very popular destination for doctors. I've had a
Yeah,
lot of doctors writing
Dubai.
me, yes, Dubai for some reason. I don't
Yeah,
know. Like, yeah, I've been training some doctors. They don't necessarily have to take the OET exam, but they just want to improve their medical English. So I just help them to take medical history, how to communicate with patients, how to write letters. But it's also becoming a very popular destination. I hear doctors
absolutely.
paid very well. So like the
Oh,
idea of this channel is to give people more option, right? Not so that people can understand, people out there can understand that, well, there are a lot of countries out there which are open to receiving international medical graduates. So I'm very happy to interview doctors from all over the world, from India, from Ghana, from South Africa, from the Caribbean, like everywhere. So
yeah.
we can weigh our options and choose whichever is best for us. Thank you very much, Sarah, for your time. We had a very great conversation. I learned a lot about the Caribbean education system, how to get certified to practice medicine in Canada. It was like really awesome. I learned a lot, and hopefully our audience out there also learned a lot from our conversation today. Thank you very much.
You're very welcome. Thank you for having me, for giving me the opportunity to share my experience, to you know share my platform. For sure, if I have any students that are requesting OET prep information or guidance, I'm more than happy to refer them to you. And I think this channel that you have created for all these physicians from various countries, I think this is so useful because, like you said, there's not just one country and one opportunity. You have the whole world in front of you, you know?
Absolutely. Yeah.
the world is your oyster, like they would say.
Absolutely. Don't put all your eggs in one basket. Yeah,
Yeah, yeah.
explore.
So
So,
thank you.
right. Thank you. So I'll talk to you some other time. Have a
All right,
good
take
day.
care.
Bye-bye.